This video is about the standard operating procedure for sample collection in testing resistance in leprosy. For this, the equipments that we need are absolute alcohol, a measuring cylinder, beaker, and falcon tubes. We also need microcentrifuge tubes, pipette and tips. Next, the method. Preparation of 70% alcohol. 70 ml of absolute alcohol is mixed with 30 ml of distilled water. This is how we make 70% alcohol. The alcohol is now ready. We use the pipette to dispense 500 microliters of 70% alcohol into the microcentrifuge tube that we had prepared and kept ready. These tubes are then capped, and multiple such tubes are prepared to be taken to the clinical laboratory where sample collection from the patient will happen. The next step is filling up the data capture form. The data capture form should preferably be filled by a clinician. This form contains the personal details of the patient, his age, his address, his gender, the type of leprosy that he has, and different details about the disease. It talks about the past history, the history of present illness, the symptoms with which he has presented, the current classification, the current MDT that he is on, if there are any complications like reactions, neuritis, all that is documented, and also the sites from where the samples were taken are documented. Comorbidities are also reported here, and then this form is signed by the clinician and dated. It's then folded and kept ready to be packed. Slit skin smear collection is an invasive procedure where 5 mm long and 2 mm deep incisions are made on the left and right earlobes, patches and forearm. After blanching each area between the thumb and forefinger, the incisions are made as above, and the superficial tissue material is scraped 4 times with horizontal strokes of the blade without any contamination with blood along the skin slit. The tissue material thus obtained is mixed with 700 microliters of 70% ethanol in a microcentrifuge tube. The tissue scrapings from all the sides are mixed in 70% ethanol in the same microcentrifuge tube. Could also use that same tissue to be taken on a slide for calculation of bacteriological index. Next is packing. The tube is then sealed with paraffin and kept in a box along with the data collection form, which is now covered and packed. This box is then couriered or posted to the respective laboratories where the resistance testing will take place.